Sagging jowls, what actually works, and why most treatments fail. Most jowl treatments don't fail because they don't work. They fail because the anatomy is misunderstood. What causes jowls? Sagging jowls are not just loose skin. They are caused by three main changes: fat pad descent, ligament laxity, and loss of structural support along the jawline. So if you only treat the skin, you are missing the real problem. Why many treatments fail? One of the most common mistakes is treating the jowl directly. Adding volume into an already heavy area often makes it look worse. This is why patients sometimes feel more puffy instead of lifted. Filler done properly. Filler can still play a role, but it needs to be done strategically. Instead of the jowl, we treat the pre-jowl sulcus, chin, and jawline to restore structure. This creates a lifting illusion, but it is not a true lift, it's structural support. Skin tightening and collagen stimulators. Treatments like Sculptra and Radies help stimulate collagen over time. Energy-based devices like RF and HIFU can tighten the skin slightly. But the key point is this: they do not reposition descended tissue. Threads. Thread lifts attempt to mechanically lift the tissue. You can see an initial improvement, but results are often temporary. They sit between filler and surgery, but don't replace either. Clinical takeaway. So the real question is not, which treatment is best? It's, what level of aging are we treating? Because each option works, but only in the right patient. When surgery is needed. If jowls are moderate to severe, the problem is structural descent. The only treatment that truly corrects this is a facelift. It repositions deeper layers rather than just masking the problem. Thanks for watching. Like, comment, subscribe, and share to support the channel.